Hey guys, Dr. Marcy here, and I just wanted to talk to you about some things that happened this week and why I think everyone will appreciate the hour-long appointments. Part of it is what you gain from having an hour of time with me. This past week, I had 3 patients come in with what they considered hip pain, and it was pain in the back of the hip that was kind of on the bum side, and it went maybe a little bit down the leg, but not really. And they said, it doesn't feel like the sciatica I've had in the past, but it's bothering me. So their insurance, all 3 of these people, their insurance actually required a referral for physical therapy, and they also have that plan where if you put down the wrong billing code and it's not part of what's considered part of their approved care, you're not really supposed to treat it because you don't have an approval or an authorization to treat that body part. Each one of these patients, I did work on the lumbar spine and the SI joint. And the SI joint, if you remember from some of our other anatomy things, the hip bones kind of come together like this to meet a more triangular shaped bone at the base of the spine. Where those meet, that's the SI joint. So that joint can get pretty irritated from a number of different things, and that triangular shaped bone that helps form part of that can tilt side to side. It can also rotate like this, and it can tilt front to back. So if that's happening, it actually puts stress on the muscles that attach from the sacrum out to the hip, and it can mimic sciatica. But the other thing it does is it puts a lot of stress and strain at the L5-S1 joint and L4-5. And then as it goes up the spine, each level there's just a little bit less stress there, but there's still stress. So for these 3 gentlemen who all had hip pain, one of them was even diagnosed with trochanteric bursitis and given an injection in the trochanteric bursa by his orthopedic guy, and guess what? It did nothing. They all had an SI joint dysfunction and stiffness in the low back that was leading to this pain in the posterior hip. By seeing you for an hour, my goal is to be able to rule out all of that and be able to give you that feedback of what's going to help you, the things that might bother it, how to kind of self-manage at home, especially if like one of them you're going to Greece for 20 days and you won't be back in my office anytime soon. And what are the warning signs that something else is going on? So if this sounds like something you've had before where you thought, if I could just get this to pop or I could get this to move, that's an indication that maybe it's not really what somebody else is telling you it is, or the internet is telling you it is, and you really need to have somebody put their hands on you and figure out what's going on so that we can better help you. If you would like help with something like hip pain that's happening in your glute and it's really deep and it feels like you can almost touch it but not really, I'd love to help you out. Go ahead and click the link below, and we have appointments as soon as Wednesday available for you this week. Have a great day.